Patients, if they have a cleft lip, are often identified by prenatal ultrasound before they're even born. So we'll often see patients as the parent ahead of time. We'll do prenatal consultations to talk to them about clefts, to help reassure them of what is coming ahead and show them pictures of patients that we've taken care of, often with the same type of cleft that their child is going to have. After the baby's born, we see them as early as possible to make sure that they're feeding well, that they have all the supplies, that the techniques are going well, that they're gaining weight. And then from then on, it depends on what type of cleft they have and would determine which surgeries they're going to need. There are a lot of variations of cleft lip and palate. There's the more typical unilateral or bilateral or complete or incomplete. And then there's complex involving not just the lip and palate, but maybe the nose, even involving the eye, the cheek, and the ear can become part of that. We have experience in treating all of those types from the very minor to the very severe. On the team itself, we have different specialists. I'm an otolaryngologist or an ENT doctor, but also I am a cleft surgeon, so I do the lip and the palate surgery and bone grafting and other types of surgeries related to the cleft lip and palate. There's other surgeons on the team that are also otolaryngologists, and then there's others that are plastic surgeons. We have a few of them that are trained craniofacially as well. Oral surgeons that help us, especially as they get older, these patients, if they need jaw surgery or they need their wisdom teeth out. They often help us also with the bone grafting where they're missing bone around the teeth. Speech pathology is a big component of every cleft team. Audiology to deal with hearing issues. We get very engaged with nutrition, especially with the babies. Genetics has been a big part of our team. They can help identify syndromes and other features. They can help with the counseling to the families as well. A few things that are unique about us is one is that we've had a long-standing team going back to the 70s. So 40 plus years of experience. We have multiple specialists that go to conferences and do mission trips worldwide. Arkansas Children's Hospital is accredited by the ACPA. There are patients that come here specifically to Arkansas Children's Hospital because we are an accredited program. And then once they're here, they see the types of patients we take care of and the care that we've provided and the outcomes that we've had. And they continue to stay with us because they really like what we do. At Arkansas Children's, the hospital itself provides a lot of support for families that are in need. The funding and the philanthropy that exists here in Arkansas really helps support these patients in all the different things that they might stand in need of. We also have been fortunate that our families have really become closely tied together, and they put together their own support groups that help a whole lot, especially as they're getting ready for surgery or they get the new diagnosis of a cleft. They can reach out to their own local support group that have had their care done here and they know exactly what they're going through, and they can provide that support for each other. As a team, we have also done something that I think is really fun, is every year we have a camp. It's called Camp Laughter. They can come and interact with each other as patients, as parents, and just have fun together, and gives us a chance as their team providers to be out there swimming in the pool with them or canoeing or fishing and all sorts of crafts and activities. And it really has helped some of our patients become lifelong friends with each other. And really, in some cases where they were nervous to come see us before, now they've seen us in a more comfortable setting. They have a lot more trust with us. And when they come in, they're excited to come to see the doctor.